Thank you all so much for coming to my webinar. Hope you're having a great day. I know despite Canada's loss, we still made it to the qualifying rounds, but hopefully everyone's day is still going great. So tonight we're going to be talking about something that affects millions of people, predominantly women, and this is why women have been told with fibromyalgia that their pain may be in their head or not validated. So tonight, we are going to discuss all the strategies about it, and I am trying to change the narrative completely. Everyone can hear me okay? Thank you, Julie. I see some familiar names, so that is great. So a little bit about me. So my name is Dr. Andrea Sulyok. I specialize in particularly complex chronic pain conditions like fibromyalgia. So I focus a lot also with autoimmune health, digestive conditions, but how I actually got started with fibromyalgia. Specifically, I got into this work when I was seeing patients that have been dismissed, who had normal blood work, other scans, and they were told by their doctors that everything looks okay despite them clearly having a lot of compounding issues. And fibromyalgia is still actually one of the most undersupported conditions that I see in my practice. So a lot of new research around it, but it's one of those emerging conditions that it's very important to target and talk about. There will be, there's lots of webinars talking about eczema, hair, gut health, but I guarantee you there's not one happening about fibromyalgia. So thank you all for coming. Now on to a little bit about the backstory of what it actually is. So the best analogy I like to give for it is, imagine you have an alarm, and this alarm is actually the nervous system, and this alarm system is always stuck in the on position. So there's never an off position. Essentially nothing is structurally broken. There's no muscle or joint pathologies. Scans look normal, blood work could be normal. But it is very real, affecting around 4% of the population, and like I mentioned, all of them are essentially women. So the peak onset is 30 to 50 years of age, and almost always before a fibromyalgia diagnosis, there's always some exacerbating condition that will trigger it, either a long COVID infection, I've seen quite often in practice, car accidents, prolonged stress or trauma. Something has to occur before the fibromyalgia just manifests itself. And it's not about the pain tolerance itself being low with it, because fibromyalgia does affect a lot of pain. It's more about the nervous system, which you're going to hear me talk a lot about, stuck in this high alert where it amplifies every signal it receives. So what it actually feels like: a lot of widespread pain. There's aching, burning, stabbing around the body, but it often could move around. So you may wake up one day with neck pain on a Monday, then knee pain on a Wednesday, and then shoulder pain on Friday. Doesn't really make sense with location or specific. There's also a really deep bone exhaustion and fatigue. It's not one of those like I stayed up too late on TikTok or I didn't sleep well. It's like I slept 10 hours and I could barely get out of bed type of fatigue. So it's very difficult to explain otherwise. And then of course the brain fog. So the cognitive piece is real and very distressing. This could be forgetting sentences mid-words and losing train of thoughts, or just feeling mentally underwater. I target a lot for brain health in my practice because there's so many things that, we measure blood work, we measure urine samples, we track our weight, but has anyone ever gotten their brain scans potentially? Not for just like a concussion. We're talking about to actually see how the brain processes fibromyalgia and all the pathways. So I'll talk more about that in a little bit. And then sleep. So the sleep, as I mentioned, doesn't matter how long someone with fibromyalgia could sleep, they may wake up unrefreshed. And touch sensitivity. This one's a really, really big one. So these are things like clothing, light, pressure, or even the temperature fluctuations that may feel really unbearable. So patients cannot tolerate a a seam in the sock, or even some bright lights could be a lot. And this has to do with the mechanism how fibromyalgia is actually processed in the brain, which I also will talk about a little bit. Then gut issues, so a lot of IBS, bloating, food sensitivities that maybe were not there before fibromyalgia onset or were not an immediate focus, and dizziness. So this is especially important because there's also an autonomic nervous system involvement that causes the dizziness. And onto, as I was mentioning, things we can actually see in the brain with fibromyalgia. So there's MRIs and also other scans that show that there's actually a lot of changes happening. So the areas of the brain that process the emotion, the pain, and the focus are all physically smaller than they should. So there's actually a loss of the gray matter volume in the brain. Then we also see areas of pain processing that are overactive. So that means they are firing more intensely than they should. As well as the brain's natural pain quieting system is weakened. So the brake pad that would, essentially stop these neurons from firing is not active at all. And what's very important is the longer fibromyalgia goes untreated or flare-ups get really bad, the more pronounced these changes actually are on brain scans. And so as one of the things I mentioned, the brain is stuck on a high all the time. So you have in a normal nervous system, you have a pain signal, the brain responds to the signal and it quiets down. However, in fibromyalgia, that signal is fired and it keeps firing. So again, that off switch is not working. So even an anticipatory pain could trigger a response. The brain would react before to pain or other stimulations. So this is very important to understand why the everyday sensations are very overwhelming to those with fibromyalgia. So a simple nudge on the shoulder could feel like a really hard push, or a normal baseline level sound could feel really, really loud. Certain smells could be very, very triggering. Temperature, it could be, kind of like today, where it was not ideal, not peak July weather, but for someone with fibromyalgia, it could feel really, really cold, especially that fluctuation. So again, I really like to use the analogy with also, imagine you have a pain volume dial, and that pain volume dial is usually at a 3. But someone with fibromyalgia, that pain volume dial may be at a 9, so it's super heightened. And that mechanism is actually called central sensitization. So that is actually the core mechanism of fibromyalgia and why it occurs. So that is the idea that any small stimulus, someone with fibromyalgia perceives a lot more intense, just because of how the neurons are firing. It has nothing to do with their pain tolerance. People with fibromyalgia actually have a much higher pain tolerance because they have been exposed to years of pain, but just because their system is so sensitive, it processes that a lot more. And we often see the brain's chemical balance also shifted with fibromyalgia. So that is, to get a little nerdy over here and technical, something called GABA. So this is one of your brain's neurotransmitters. With GABA, it's specifically depleted in fibromyalgia. So that means its job, which is to be the brake pedal on the nervous system, to really slow things down. And it's found in a lot smaller levels in fibromyalgia. So GABA is one of the biggest findings that we see chemically going on, as well as the opposite, so glutamate, another neurotransmitter. This is actually the excitatory neurotransmitter that is responsible for processing pain signals, but it's actually elevated. So because it's always elevated, all that pain, which I was mentioning with central sensitization, is louder, elevated, and the fatigue is worse. Another one, substance P. So substance P is essentially the pain amplifying neurotransmitter as well, that is up to 3 times as elevated in fibromyalgia. And then very lastly is serotonin and dopamine. So I'm sure everyone has heard of these feel-good hormones and molecules. They're very responsible for our good sleep quality, our pain, our mood, motivation, and things like that. where chemically in fibromyalgia, the brain shows that this is very depleted. So because of this, one of the often conventional treatments for fibromyalgia that is actually successful is antidepressants that work to actually fix the imbalance of serotonin and dopamine in the body. But again, I'll be talking a lot about some pharmaceuticals. It's not for everybody, but it is definitely one thing that is helpful to that serotonin. And then inflammation, activity is another really big one. So vitamin D is our happy vitamin. We get it from the sun, but we also get it to help the immune system. Even though oftentimes if you are sick, you think to take some vitamin C to help with the flu and everything, but actually vitamin D is the most important to helping your immune system. So with fibromyalgia, these levels of vitamin D are very, very low. Like often, we are in North America. At the end of the day, no one's vitamin D is going to be great, especially since we're not outside as much and we just cannot get it as well as we should here. But in fibromyalgia, correcting this deficiency, because it's even lower than normal, is really, really important to help pain, sleep, and mood especially. And then now I'm going to talk a little bit about all the pharmaceuticals and all the approaches that work with it. So as a naturopathic doctor, I always work to manage side effects with other medications, and I'm never the type to tell someone to discontinue it completely. If anything, it's my job to help educate people on their pharmaceuticals, but also to work along with it and discuss all the options. So one of the things that's very important is talking about anti-inflammatories, because anti-inflammatories like your Tylenols, Advils, ibuprofen, these all just target the inflammation in the tissue. But really, as I have ranted already for 20 minutes about, fibromyalgia is really a nervous system processing disorder. So this has very little effect, but because the body is in pain, that's often the first go to it. Another one is opioid medication. So opioid medications actually can make the nervous system more sensitive over time through opioid-induced analgesia. So this is actually really important to talk about if people are taking opioid medications, and just educate them that it is potentially making their fibromyalgia worse. Same with steroids. Steroids actually further can stress the cortisol and HPA axis, so there's very little benefit with the steroids. But there are some medications that have been beneficial. So these are things like gabapentin, pregabalin, amitriptyline. They all just work to calm the overactive pain pathways in fibromyalgia. But one thing that's important to know, there's never just one pharmaceutical or even supplement that is sufficient. Fibromyalgia really is a multi-system approach. That's why, as the title of the webinar, it is one of the hardest conditions to treat, just of how many symptoms and how many things we need to target with it. But it's definitely, we treat the people and the person, not just the condition or the symptoms. So every approach is always different, and that's what I tell all my patients in practice. So I talked a little bit about why it is so challenging to treat. That is just because there is no single cause. So the nervous system, which is the main drive for it, but the brain system, the gut, hormones, and immune system all simultaneously may get out of whack. And with that, pain actually feels more intense than needed because the system is in overdrive. So as I mentioned, people with fibromyalgia actually have a higher pain tolerance since they have been coping with the pain for so many years that has been amplified. There's also often sensitivity to medications and supplements. So the body needs to have a very gentle and layered approach into treating it. And even with any medications and supplements, the dose is very important, and trying to manage it and go up from there. So again, it is really about the whole system and treating it all together, not just one symptom or one component of it. Everybody is different, and with the fibromyalgia often comes other things like IBS, anxiety, migraines, sleep disorders, and even interstitial cystitis. So trying to target everything is always difficult at first, so always doing a systematic approach is what I like to combat. Onto the naturopathic medicine side of it. So as I said, we treat the whole fibromyalgia, not just the person with fibromyalgia. So that is in terms of targeting the root causes, nervous system regulation, energy production, gut health, inflammation, and working alongside with conventional care. So building good referral relationships if we need to, and always modifying treatment plans, because no two people are alike and everyone has their own protocols. So often with fibromyalgia, I do a lot of investigations into the triggers, the flares, as well as overall health history to best assess it. And then in my toolkit as a naturopathic doctor, these are some of the common things that we use and I like to incorporate, but I'll talk a lot about detail separately. The botanical herbs especially are important for the stress response, and calming herbs to regulate the nervous system, and also targeted supplementation, nutrients. So I always run a lot of blood work and find a widespread of deficiencies that do need to be corrected, and targeting energy production, pain calming systems, magnesium, as well as sleep and mood. So the first one is the herbal and botanical medicine itself. So rhodiola, ashwagandha, holy basil, and several others. These are all things called adaptogens. So what adaptogens do is they help regulate your stress response and restore energy. So they're very helpful in cases of burnout or exhaustion, which is very common with fibromyalgia. And then also calming herbs, like we want to give things to calm the nervous system as well, not just help the body with the stress. So anything like lemon balm, valerian, skullcap have been very documented. The reason we don't do sedatives is just because of how the brain is in that perceived state of pain or amplifying signals. Often with things that are sedating, whether it's a botanical or pharmaceutical, is actually a lot harder for the nervous system. Then lastly, acupuncture. Acupuncture is really helpful in stimulating the endorphin releases and processing the central sensitization mechanism, as well as the serotonin and substance P. So a lot of benefit with acupuncture, especially for fibromyalgia, but it's not for everybody. That's why there's always a big toolkit of things I like to do to help. And then, as I mentioned, some targeted nutrients. So by now everyone would have passed grade 9 science class. In grade 9 science class, we learned that the mitochondria is the powerhouse of the cell. So what does that mean exactly? The mitochondria is the thing that makes ATP, which is what your cells use to make energy. So the more we can support the mitochondria, the better your cells can produce energy efficiently and use that ATP. To do that, I always use something like CoQ10, which is directly helping the mitochondria, L-carnitine, B vitamins, fish oil. They all will help with energy support. And then there's also a lot of pain calming things I like to use, such as magnesium malate, palmoethylamide, or PEA for short. This is very beneficial for fibromyalgia as it's a naturally occurring fatty acid, and it has a lot of anti-analgesic properties, which really help fibromyalgia at the nerve level and pain processing. And then, of course, for sleep and mood, there's 5-HTP, which is a precursor to the serotonin. So your body makes that before serotonin. Low-dose melatonin as well. And low-dose melatonin, this is something I want to talk about because in stores, whenever we go to either Healthy Planet or Shoppers, we see melatonin, coming in forms of 5, 10, even 20 milligrams. When actually research says that the lower doses are much more effective for helping sleep aid, but specifically for fibromyalgia. That's because your body naturally produces a physiological amount of melatonin with the pineal glands that is very, very low. So your body naturally will make 1.5 milligrams of melatonin each night. So when you take a supplement at that dose, it actually is way more better in getting you that more restorative sleep than high doses of melatonin. Even though you would think the higher doses are needed to knock someone out for fibromyalgia, but also in other certain chronic conditions, low is always better. The magnesium, there are so many types of magnesium out there, but magnesium malate is better for the pain processing, and that's the form I like to use for patients with fibromyalgia. And then correcting the vitamin deficiencies, vitamin D, B12, and zinc. These are all going to naturally help the body reach more strength to help be supported for fibromyalgia. And yeah, with all of these, the goal isn't to take everything at once, right? So that's one thing I really do stress with people. It's more to identify specific deficiencies and imbalances and then correct them at the right order. So it's a very personalized protocol. It's not about, everyone one size fits all or does 50 things at once. So for gut health as well, I wanted to mention there is the gut and brain connection, right? So the vagus nerve is the highway connecting your gut and your brain, and all of the serotonin is also made in the gut. There's a lot of correlation with, stressful moments, and you literally have that pit in your stomach or nausea or anything else. It's different for everybody, and that is because of the gut and brain connection. So patients with fibromyalgia, we already know their brain is stuck in the pain processing overdrive. So with that, of course, they're going to have some gut dysbiosis, IBS, and other symptoms with the pain. There's no coincidence. And healing the gut inflammation also is important because the more the gut is inflamed, the more the nervous system will be inflamed. So with that, it's all about building a targeted protocol, as I'm saying, with the right probiotics or omega acids and quercetin, just to really help for the gut health specifically. And gentle movement, so a lot of exercise is often too much for fibromyalgia patients just because recovery is always harder. So very gentle movement and starting from there and working our way upwards. It's really important for the nervous system to have daily movement, and then sleep hygiene. So the better you're able to sleep at night, the more you are able to repair everything from the day before, the day of. So when you're not getting good sleep, this goes for everybody. That means you are not replenishing everything from the night before, and it leads to a lot of imbalances and diseases in the body. So now I want to share a real life story with a patient of mine that did have fibromyalgia. So that's not her, obviously, or her name, but everything else is on par. So she was 36 years old. She worked a job at the post office. She was often lifting boxes that were heavy every day at work, and in the middle of an ongoing divorce. So there was a lot of stress in her diet, and one day she just strained her abdomen at work, and she wasn't sure exactly what it was. She went to the doctor, and they diagnosed her with anterior cutaneous nerve entrapment syndrome, which is a really complicated way of saying one of the nerves in her abdomen was being compressed, and due to that compression, it was causing ongoing pain in her abdomen. However, Maureen, 8 months later, after that initial happened, was beginning to have more pain everywhere else in the body, low energy, brain fog, fatigue, anxiety, and a year or so later, she got formally diagnosed with fibromyalgia. And this is a very classic fibromyalgia origin story. There's always a physical trauma that happens. The nervous system never fully recovers from that trauma. There was originally a lot of stress with it, and that central sensitization, which I talked about, kicks in. So despite she was doing everything right and following conventional advice, she was not improving, so she was frustrated and trying to really get a grasp of her treatment. So when she came to see me, one of the first things we did was for that pain calming support, we did supplementation with PEA, a very low in anti-inflammatory diet. So anti-inflammatory diet is, again, a very specific, not fun type of diet to be on. There's a lot of foods that are inflammatory that most people don't realize. I'm not talking about regular processed food or sugars or starches. I mean things like potatoes, tomatoes, eggplants, lemons. These are all actually very inflammatory, which in some cases are perfectly fine. But with someone that already has ongoing inflammation with fibromyalgia, that's one thing to avoid. And then her stress and adrenal glands, we were able to target with rhodiola, supporting her sleep, mood, and digestion with vitamin D, 5-HTP, and then the gut healing protocol, which goes in with, again, there's so many probiotics out there, so many strains, but knowing exactly which ones target and what are best for people is one thing I specialize in. And then the nervous system, she was not super active, so just incorporating stretching. From there, Maureen did yoga for a little bit. Then she progressed to Pilates. So just getting that movement in as well as walking, and then weekly acupuncture, mindfulness was very beneficial. And at 6 months, her pain score that was originally like a 9 out of 10 pain went to 2 out of 10. Her symptom severity score dropped to a 5. So the symptom severity score, you guys will receive at the end of the presentation or by tomorrow in your mailbox a fibromyalgia guide and symptom tracker. So that is, very helpful if you or anyone you know does have fibromyalgia and wants to get more information on it, things we talked about. But the symptom severity score is one of the diagnosis things and also baseline things we use for fibromyalgia. And then anxiety score as well was improved with Maureen. She was able to have more mental clarity, live life improved, energy, and it's very important to know the recovery is not linear, but it's definitely possible. So this happens when you treat the whole system with the right support and work alongside with the person. And one thing to talk about in terms of the results with fibromyalgia, so they are documented in the brain scans and blood markers, as I mentioned. So there's a lot of science backing up it. I also talked about the chemical imbalances in the brain that happen in fibromyalgia, and the brain scan itself showing decreased gray matter, and then the blood deficiencies, again, vitamin D, iron, B12, very high cortisol, hormones for women are always skewed, so that is one of the biggest things. And then ferritin or CRP or ESR. These are just blood inflammatory markers. So with fibromyalgia, there's a lot of inflammation, a lot of these blood markers go up. But that is just one of the mechanisms, because if you leave after today and retain nothing from it, again, there's always a replay for the recording. But just know that it is all about the nervous system in fibromyalgia. So with fibromyalgia, the nervous system's pain alarm gets stuck, but it can be calmed. So the same way it got sensitized, it can still get desensitized. The brain has a lot of neuroplasticity, and the brain can change. And with that, there's conventional medicine, but it's often the wrong mechanism for fibromyalgia. So the anti-inflammatories are targeting the inflammation, but it's not the right kind of path. The steroids or opioids are also not the same mechanism treated with fibromyalgia. So a personalized whole body approach is what's really needed to address the flares, triggers, root causes, and create the best treatment for fibromyalgia. And recovery is very, very possible with the right support. So some questions you can take from this is the big one. So can we actually reverse the changes fibromyalgia causes in the brain? Absolutely. So as I said, neuroplasticity is very real. The brain can reorganize, rebuild that gray matter, and recalibrate that pain processing. It does take time and with the right interventions and consistency, but it definitely can happen. Can the nervous system also learn to process pain normally again? Absolutely, it can. So, whether it is doing the acupuncture, botanicals, or targeted biochemical corrections, at my clinic, we also offer pulse electromagnetic frequency, which just helps the cells of the body regenerate more ATP, repair themselves, and have that cellular healing we want. So there's so many things to incorporate in terms of the pain, but with everything, it's one thing at a time. And how do we support the whole person, not just the symptoms? This is very important that I tell all of my patients. So we really want to work with the whole totality of symptoms, the whole totality of presentation, not just individual symptoms. So one thing I do want to leave, fibromyalgia is one of the most chronic conditions, but it is treatable. So despite conventional treatments and medicine being limited, there's a lot of new evidence and research and investigations that go into confirming the best plan. But clinically, there's a lot we can do, so one thing at a time. And if there's any questions, I can take a couple or stay. Oh, that went by fast. But essentially, yeah, I did mention, but also to reiterate, you will be receiving a fibromyalgia guide since you have signed up, and a symptom tracker with everything included. As well, I do want to offer any areas of specialty. So when I do discovery calls with patients or people interested, it's often to find out about what someone's health goals are, what my specialties are, and how they can best align before someone even would need to book an appointment. It's more just getting a sense of what each other's goals are and how to best make the treatment catered around it. If you want to keep in touch through any social media or email, or otherwise, as I mentioned, booking a discovery call. And if there's any questions, again, thank you all so much for chiming in. Hope the night goes fantastic.